Hi, my name is Ankit Desai. I'm a board-certified plastic surgeon here at the Florida Plastic Surgery Group, and I'm here to talk to you today about breast lift procedures. The most common medical term used is mastopexy, and I'm not going to get in today about talking about breast lifting with augmentation. What that is where we lift the breast and put in an implant. I really want to talk to you just about those patients that don't want excess volume and don't want to enhance the volume of their breast, but really just want to lift their breast. Try to give you an example. This is what we call ptosis. Ptosis is just the medical term for when the breast generally kind of droops or sags down below a little bit. And when women that want to rejuvenate their breasts, we see them, they want to keep their cells natural. They don't want implants, but they want their breasts to not hang necessarily on their abdomen, and they want it to kind of have that perkier look that they had maybe when they were in their 20s or 30s. We recommend for those patients a breast lift procedure. And what that really is, I think traditionally, historically, breast lifts, we thought that the skin was kind of stretching and we would then tighten the skin. And that's kind of a misnomer. I think the breast lift procedures that just use to tighten the skin actually don't last. And so they may look good initially, but it doesn't give the patient a good long-term result. And that's because the skin is the thing that is inelastic, that's stretched, and it doesn't really help create long-term support. So when we see patients for breast lift, who are candidates? Patients that are breastfeeding, patients that aren't smoking, patients that are in generally good health. And we talk to them about rejuvenating their breast and lifting and removing the excess skin, but really just reshaping the breast itself. Breast lift procedures, we generally will reposition the nipple, and we will reposition from a downward to a more central location. And then we want to lift the breast itself so that we can bring it up to a youthful, perky position. We leave the nipple attached to the underlying breast tissue so women can still breastfeed. They'll still have sensation to their breast. And generally, recovery time we talk about is somewhere in the term of 3 to 4 weeks. The incisions all have dissolvable sutures, and they're all under the skin, and patients generally can shower the next day after the procedure. And so what's the difference between just tightening the skin and reshaping the breast? Well, in general, if we just use the top layer, the skin that's given away, that result doesn't last. And so what we really want to do is to reshape the breast. And we basically create pillars, so internal sutures that bring the breast together. So if we remove a small wedge of breast tissue down in the middle bottom of the breast, we can then use tissue all the way back to create an internal support structure. In the medical terms, we call those pillars. So there's a medial and lateral or inner and outer pillar, and we use that to hold the breast up so we get a result that not only lasts a year or two, but lasts about 10 years. When we do a breast lift, it does involve incisions. The most common incision we talk about is a lollipop incision. So it's an incision that goes around the nipple and down, and sometimes we even add underneath scar. And those incisions help us, 1, to reposition the nipple, and then 2, to narrow the breast, and then to create that pillar and internal support. Patients don't need drains, they can shower the next day. In general, patients just need over-the-counter medications for pain, and so I think it's a really rewarding procedure for patients that want to have a perkier breast, but not want to have implants or anything unnatural, and really just want to stay the volume that they are now. So if you're considering mastopexy or breast lift procedure, contact our office, and we'll be happy to help and give you more information.